advisory team. We have invited STP ComplianceEHS back to discuss the regulatory landscape across BC and throughout Canada, and the trends that will impact our members and beyond. At STP, Frank is the Director of Product Management, leading the development of compliance solutions to navigate complex regulatory requirements. A product expert, a lawyer, Frank brings deep expertise in workplace safety, environmental regulations, and corporate sustainability to the conversation. So welcome, Frank. And joining Frank is STP Director of Partnerships, Shannon Major. Shannon manages relationships with organizations like the Alliance to help members monitor and leverage regulatory intel for global compliance. So before Frank and Shannon get started, reminder that you can use the QA icon to submit any questions at any time during the session. But I'd like to go ahead and welcome Frank and Shannon here today.
Excellent. Well, thank you very
Wayne.
much.
Happy to be here.
All right. So I'm just gonna go a little bit further into about me, just to hey, why are you listening to me? I'm actually a former certified auditor with Eco Canada. I'm actually just in a non-practicing mode with my new role at STP. But prior to that, for 14 years, I was actually helping Canadian organizations like yourselves performing audits, both from a regulatory standpoint, and I was also an ISO 14001 and 45001 trained auditor. I didn't just audit, I actually implemented systems on some pretty big construction projects and in manufacturing across Canada. But I am going to let Frank do a little deeper dive about him as well.
Yeah, no, thanks, Shannon. I think as Wayne mentioned, I'm an attorney by trade, and for the past 20 years or so now, I've been studying and tracking regulatory and legal changes as they relate, especially in the environment, health, safety, sustainability areas. And I really enjoy working with clients to help them understand how these changes impact their businesses, and then, like you, help them set up programs and implement tools to help them manage those risks and stay in a state of continuous and proactive compliance. So looking forward to going through things with the group today.
All right, thanks, Frank. So before we go into the deep dive of regulatory changes that might impact your operations this year and beyond, we wanted to step back and reflect at the big picture. So at STP and the Alliance themselves, we're really advocating taking a proactive approach to your compliance, meaning we are going to support clients identify what are those EHS compliance obligations that apply to your organization and keeping you current on those changes so that you can focus on ensuring that you're communicating and reflecting those changes within your business operations, as well as evaluating the compliance obligations on a frequent basis to identify any potential non-compliance before you have major consequences. So the last thing we want to do is that you didn't know about something, or you had this big regulation that just came about and someone comes in, you get a fine, or your reputation gets damaged. So our job here is to let you know of things ahead of time so you can react to it before major consequences. We do have the tools to help you with that at STP, but we hope that by going through some of these regulations on this webinar that we're going to help you on your proactive compliance journey. For the next 30 minutes or so, Frank and I are going to dive into what some of those regulatory changes have either recently come into effect, they're in a proposed state, or we anticipate that they're going to be proposed by BC WorkSafe BC. We also bring awareness to the regulatory changes that are similar to those in BC, but that also occur across Canada. And in some cases, we even brought up the United States, just for those that have national or cross-border operations. And as I saw people typing in their locations, I did see that we have a few members that are coming in from outside of British Columbia. So on our list are several topics that WorkSafe BC's Board of Directors approved within their Policy, Regulation, and Research Department's 2024 to 2026 Occupational Health and Safety Regulation Work Plan. That work plan has about 20 focus areas where they're going to be consulting both internally and externally with stakeholders to review and update both policies and regulations regarding occupational health and safety. Though we're going to go through some of them, we do encourage you to access that work plan. The link is going to be provided in the presentation afterwards. So you can look at the full gamut of those requirements because we're only going to have time to do a select few. We're going to start with reviewing some of the changes that recently came into effect. So one of the most recent ones is under Part 5, your chemical agents and biological agents under your health and safety regulation as it's relating to emergency response planning. Changes primarily provide further clarification of what the original requirements are. So depending on the maturity of your emergency response program, you might only need to do minor changes. But that said, this amendment really introduces the requirement of worker participation. So on February 3rd, when this came into effect, either your joint health and safety committee, your health and safety rep, or where neither of those are required, workers at the workplace that are familiar with the processes are to be consulted during the development, the implementation, the review, and the update of your emergency response plan. And the term plan actually includes doing that hazardous substance inventory, your risk assessment, emergency procedures, and any programs, as well as your training and the drills. And in addition to that worker participation, they also have the requirement that a qualified person must be consulted when conducting your risk assessment. A qualified person, they didn't change that definition, so you might already be familiar with that. But the definition of that is someone being knowledgeable of the work, the hazards involved, and the means to control the hazard, either through their education, training, experience, or a combination thereof. The requirement to review the emergency plan is still annually, so that hasn't changed. However, they've added that you also need to review the plan after there has been an emergency that causes or that could have potentially caused a serious injury, illness, or death, when there is a significant change in the workplace, or when that risk assessment is kind of deemed invalid. So you need to kind of redo it again. One other change in the requirement is to conduct emergency response drills at least annually. Or after any significant change to the plan. So previously you had to do a drill, but it didn't actually specify a timeline. So now you have to hit it. And I just want to also highlight that earthquakes and other natural disasters such as flooding and forest fires are now actually going to be considered reasonably foreseeable emergencies just because of their recent occurrence in British Columbia. So if your plans don't already capture that, that is definitely one area that you want to look at. So more details can be found at the webinar that actually Manufacturer Safety Alliance co-hosted with WorkSafe BC on their website. So the link is provided there. But I do want to flag to you that there are 9 OHS guidelines currently under proposal and open for comment that will kind of complement this regulation amendment. So you have till April 4th to go on and provide your comments. We're going to jump over to first aid, which actually another amendment that came into effect, but in November of 2024. And that was under Part 3 of your British Columbia Occupational Health and Safety Regulation. And there were also 19 guidelines that supported that change as well that were amended. So if you are based in BC, that new requirement or amended requirement is that the employer must prepare a written risk assessment of the level of the first aid required at the workplace. Very similar to the emergency response planning regulatory changes, your Joint Health and Safety Committee or your health and safety rep must be consulted in the development, review, and updating of that assessment. What wasn't specified is that if you don't have a Joint Health and Safety Committee or health and safety rep, that you would consult your workers. But that's the trend that I've seen across all of the regulatory changes. So as a good practice, if you have neither, I would involve some of your workers in that first aid assessment. Also similar to that emergency response planning reg change was the drill, or that you're going to have to do drills to ensure that your first aid procedures are effective, and they need to be performed at least once a year or when procedures change. So maybe line up those drills if you want to. A majority of those changes are in Schedule 3A, which is really amended to consider your 4 workplace characteristics. Those characteristics are the number of workers at the workplace, the hazard rating assigned to your industry, whether the workplace is remote, and whether the workplace is less accessible, so like by boat. This amendment was really to harmonize with the CSA Z 1210 and 1220 standards related to first aid and training and first aid kits. So you're going to see some changes along your first aid training, which was previously referred to as level 1, 2, and 3, which are now basic, intermediate, and advanced. Your duration of your first aid training might have altered, specifically if you were an intermediate or previous level 2. So just make sure that you're reaching out to a certified trainer to provide that first aid to make sure you're in alignment with the new regulations. You're also going to see that your first aid kits are kind of renamed from personal level 1, 2, and 3 to personal, basic, intermediate, and advanced. And some of the requirements of what need to be in those kits would have been tweaked as well. And also important to note that if you were certified prior to November 1st, 2024, but it's still in effect, that will actually still be accepted as an equivalency to the new requirements until their expiry date. Again, more details are on the website of Manufacturing Safety Alliance, as they also provided a webinar on that. But moving across the requirements in Canada, I just mentioned that BC adopted or kind of aligned their framework with the CSA Z 1210 and 1220 standards, but they were the 2017 version. In May of last year, they actually released their second edition, which is their 2024 version. Now, again, BC actually didn't officially adopt them or reference them in the regulations. They were just in the background aligning to them. But there are other provinces across Canada that formally adopt these standards. So for Z 1220, they are actually referenced in law in Saskatchewan, Manitoba, Quebec, Nova Scotia, New Brunswick, Newfoundland and Labrador, and PEI. So if you are in any of those provinces, you are just going to want to take a look at this new standard. And for Z 1210, they are adopted in Manitoba and Nova Scotia. So you'll also want to look at those. Also, to stay on the line of first aid, it was a busy year, or will be a busy year, I guess. So Prince Edward Island just changed their general regulation under the Occupational Health and Safety Act to align with the CSA guidelines. And that came into effect on January 1st, 2025. So these changes are very similar to BC, where they're going to require employers to conduct a workplace first aid risk assessment to determine the appropriate first aid training and kit selection, and based on risk, not on your total number of workers. And you're not really going to see this in any kind of like RSS feed or from STP quite yet, but Ontario is currently reviewing their first aid program to align with the current CSA criteria. This is just posted on the WSIB website, saying that they expect to launch it in 2026, but there are no formal proposals out there right now. So this is more of a flag for you to stay tuned to make sure that you can see when those changes are going to be proposed later this year. And I'm going to pass it over to Frank.
All right, so I'm going to talk about some pending updates related to workplace harassment and violence. So of note, this is one of our top global trends that we are watching from a regulatory standpoint. So not just in BC, but across Canada and across the globe, which I'll talk about a little bit later. But just to, I guess, delve in a little bit to the BC specifics for this group. So part of the work plan for the upcoming year are proposed amendments to the harassment and violence standards. So the current state of the existing regulations are that workplace behavior hazards are addressed in 3 separate places throughout the regulation. And really the main thrust of these amendments would be to replace the existing regulations that are dispersed and consolidate them into a single comprehensive framework that addresses workplace conduct, violence, bullying, harassment, all under one framework. So if you do go in and read the proposed changes, they are available in detail. The elements here are that employers would have to implement, again, a consolidated harassment and violence prevention program. So that involves a risk assessment process to determine whether such risks exist in your workplaces, and then if they are present, to identify effective controls to either eliminate or minimize those risks. There are requirements then that specify the details of what is required in terms of written policies and procedures, training requirements for both supervisors and workers, so distinct requirements based on the function. Similar, Shannon kind of hinted at it during the first aid section as well, but there is the requirement then that any new programs or any revisions should be prepared, reviewed in consultation with a joint committee or with workers if there isn't one present. And then also there are more details specifying the requirements for record keeping, for investigating incidents that involve harassment or violence, and then also resolving those incidents. WorkSafe BC has been pretty active in putting out information on these topics. Again, this is a hot topic. So, I just wanted to call out 2 recent additions for anyone who's not aware. There was an FAQ document that was posted just this month, actually, so in February of 2025. And they also put out a psychological health and safety framework document in July of last year as well. So, links are there available for in the presentation that'll be sent out after for anyone who's interested. But I did want to just touch on, kind of, again, we said we wanted to not limit just to BC, but to go beyond. And so, talking of this in terms of the global trend, and relating this back to this concept of total worker health that we've been seeing. So the concept of total worker health, it's kind of a catchphrase, a buzzword that you're hearing a lot more and more, especially over the last couple years. But it kind of dates back about 10 years or so. It was first coined by the National Institute of Occupational Safety and Health, or NIOSH, I guess, as most people would refer to it. And it's grown and evolved quite a bit ever since then. But I did just want to, we could easily fill a full webinar on this topic. I'm really just trying to give a very high level introduction to the concept here. But it's defined as policies, programs, practices that integrate, I think that's the key word there, that integrate the production of work-related safety and health hazards with the promotion of injury and illness prevention efforts to advance worker well-being. So there's another kind of concept, the overall worker well-being. And so this is what you're seeing now in these evolution or these changes in regulations that we're seeing now are not so much focused on the traditional safety standards that many of us may have been familiar with 10, 20, 30 years ago, but evolving it to address things like psychological hazards, organization of work, compensation of and benefits. So, the rise of mental health benefits and whatnot, and an overall work-life integration. Just to kind of give a very simple illustration of the concept there as well. You know, I put up, this comes directly from the NIOSH website that has a lot more details of kind of defining this concept. But if you take the standard hierarchy of controls that many health and safety professionals are familiar with, you have your levels of effectiveness for addressing hazards, from elimination being the most effective down through personal protective equipment. And just on the right side, then kind of layering the total worker health concept over that hierarchy of controls, and how someone who's looking at it more holistically or beyond the four walls of your facility might think about how to implement controls, and especially tying it back to those proposed amendments. And there are the requirements that include risk assessment, identification of controls, and implementation of controls, of really, you know, layering on that concept of not just the strict, you know, standard hierarchy of controls that many of us are familiar with, but that evolved way of looking at it, of that overall total worker health concept. So on the next slide, I gave a couple other examples. Again, we want to take this beyond BC for our, you know, show a little bit more of a North America-wide perspective. So I just highlighted two other updates that are occurring across Canada. So one in Ontario that was recently passed at the end of October of last year. And this one, I think, is noteworthy. It amends the definitions of workplace harassment and workplace sexual harassment to include virtual scenarios, so behavior occurring virtually or through the use of information and communication technology. So, you know, again, we're reflecting, I think, changes in how people work, you know, in particular, more remote work and more working with via meetings or via more computer-based communication. And then at Alberta, I just wanted to add that there for more of a rounded overview. It's very, you know, I think the changes there are more similar to what I just discussed in BC. So Alberta had two distinct programs for harassment and workplace violence, and what they've done, which took effect in December of last year, is to consolidate those programs into a single framework, much like what we're seeing BC propose in their changes. There are, I've hinted or listed there, the annual review requirements for Ontario. There's a 3-year minimum review period for Alberta, but then they also have that caveat of when an incident occurs or when circumstances change. So this is a good opportunity, I think, to raise awareness and go back and check those policies to make sure that you're addressing those hazards effectively.
All right, so we'll jump over to combustible dust. So WorkSafe BC's research department proposed a set of dedicated provisions to Part 6, really targeting the management of health and safety risks associated with combustible dust in the workplace. So essentially, amendments were made to Section 6 there. They were proposed in 2023. And were expected to be implemented in 2025. It sounds like they're just getting a little more time is required just to review the feedback from the consultation. And so implementation may not be expected until 2026. Essentially, the targeted requirements under this proposed is to apply to all workplaces that handle or generate dust as a product, a byproduct, or waste, unless it's dust sealed in a commercial package. The new requirements that are proposed are to identify whether dust handled or generated at the workplace is combustible dust, and if so, to prepare and update a combustion risk assessment. So again, seeing a lot of trends on risk assessment. If this risk assessment does identify a combustion hazard, then you need to do a combustible dust management program that is going to include provisions related to training and instructions as well. This has the similar requirement to all the others where you want to have worker participation. So you're going to have your joint health and safety committee, safety rep, or workers be part of the preparation as well as the updates and amendments. This also has a requirement that you have a qualified person be consulted when you're identifying if the dust is combustible. Now, if you don't do that, you're just going to be kicked into a higher degree of requirements, as it has to be assumed that the dust is ignitable and deflagrable. Can never say that word. There's also a lot of requirements added around just the controls that you need to have in place based on the type of equipment that you have related to the risks at the site. Again, Manufacturer Safety Alliance did a webinar on this, and so the link will be provided so they can do a deeper dive for you. So I kept saying risk assessment. I'm going to say it again. So there's this implied obligation in the regulations in BC that you're going to carry out a risk assessment for all of the workplace. However, it's really only regulated for specific high risk hazards at this point. So you've heard some of the ones that are proposed coming out, but the ones enacted right now is around avalanche, ergonomics, asbestos, for examples. So really the objective of the review right now is to change it more to like you do a risk assessment of your whole workplace. The proposed requirements are really based on the CSA Z 1002 standard, which is the Occupational Health and Safety Hazard Identification and Elimination and Risk Assessment and Control Standard. They're also hoping to make these amendments to align with the federal Canadian Occupational Health and Safety Regulation, as well as the Alberta Occupational Health and Safety Regulation. So if you want to get a head start there, that's where they're kind of leaning towards. These new requirements are going to include the employer responsibility to identify every known or reasonably foreseeable hazard at the workplace, to assess each risk to the worker from the hazard and the severity of the harm from the hazard, and then management of the hazard with a hierarchy of controls, really focusing on elimination first. And then you have to actually keep a record of that risk assessment. Again, it's going to have, or it's proposed to have this this joint health and safety committee, health and safety rep, or workers input as you're preparing and updating that assessment. And I just got to say, the good news is that if you are core certified or ISO 45001, you've already probably done this risk assessment. You're probably already checking that box. So you're probably ahead of that. But just stay tuned, as the consultation closed over a year ago, but we haven't actually seen the official release to come into effect. So stay tuned. Gonna change gears a little bit because I think it's important just to highlight a little like yay for Canada that we have officially released our first sustainability standards. These are both, there's two of them, the CSDS 1 and CSDS 2, both kind of built upon and aligned with the International Sustainability Standards Board standards, with some modification, which we're kind of calling them as like transition reliefs. I'm not going to dive into these. I would just want to highlight they became voluntary on January 1st of this year. Your organization can definitely take a look at these and decide to adopt and report to them voluntarily for now. But it's really now with the kind of government agencies to look at adopting these and kind of mandate them as law. The same time that these were released, the Canadian Securities Administrator did issue a statement noting that they're working towards a revised climate-related disclosure rule. So they are going to consider these CSSB standards with potential modifications that are going to be more appropriate to the Canadian capital markets, as they say. But they are emphasizing a climate-first approach. I'm just kind of generally curious with this, and remembering that the S really incorporates health and safety as well. So if you want to go download those standards for free, they're available until March 31st on the CPA website. So you just have to go download the sustainability handbook, and then you can get access to it and take a look at what that all includes. So the link is in the presentation as well.
Okay, and then yeah, kind of continuing the theme of climate and the focus and growth and those areas. The next topic we wanted to talk about is related to heat injury and illness. So this again is part of BC's work plan for the coming year. There are 3 elements to it, so they've broken it down into 3 distinct areas. So cold exposure, solar radiation exposure, and heat. On the cold exposure side, this is, I don't want to call it routine, but it's effectively just updating the current references to the most current ACGIH standards. So currently they refer to the 1993 standards. Those have been updated, I think at least a couple times since then, but the most recent is 2018. And so this is updating the references within the regulation to that. Solar radiation exposure, I think, is a little more impactful. So exposure to the sun is not currently listed as a hazard that workplaces are required to consider during their risk assessment processes. It's actually specifically excluded. Solar radiation is listed as an exclusion, but based on the rise in understanding or the appreciation of the risks related to skin damage, I guess most notably skin cancer or eye damage in the form of cataracts. This has really gained a lot of attention. And so the proposal on the books, or what they're putting forward, is that this would require employers to assess solar radiation exposure. And then if it is present in the workplace, or if there are risks, to implement controls to manage that. And then on the topic of heat specifically, BC already has heat regulations at the sections noted there below within the occupational health and safety regulation. The current, from what I was reviewing most recently, they're still sort of in a recommendation stage of recommending a holistic review of the existing heat exposure requirements and updating the recommended corrective measures just based on the more, or I guess most recent scientific understanding of those impacts. Heat exposure, again, we talked about workplace harassment and violence being a big trend globally. Heat is also ticks that box. It's definitely one of those trends that we're seeing a lot of activity in Canada and then also globally as well. So I did put up an example there again from Ontario of they're also proposing heat stress regulations in their Occupational Health and Safety Act. More notable there because Ontario does not currently have a specific standard dedicated to heat safety. So this would be a new standard in Ontario compared to British Columbia, where there are existing sections in the regulation that currently deal with the topic, but this would be new in Ontario. And I did, just to try to give a little bit more of a global perspective, we wanted to talk a little bit just about the trend overall. So we're using the US because we're limiting to a North America focus, but I think this slide here illustrates the rise of this topic, and this is, I think, indicative of other areas around the world as well. So if we look at in the United States, going back to 2006, California was the first of the states to implement a safety standard specific to heat exposure. It was limited to outdoor workspaces, so kind of agricultural settings. It gets quite hot there in the summertime out in the desert, and so they came out with these standards. But as you can see, it's really taken hold in the last 3 or 4 years. So, starting with Colorado, Oregon, Washington, California, again, expanded the scope of their regulation. And then most recently, Maryland and Nevada, other states that have adopted state-specific requirements that impose standards on workplaces to assess for heat risk of heat exposure and to implement measures to mitigate it. I did want to note down at the bottom too, I put a note, there's actually a federal proposal from the Federal Occupational Safety and Health Administration, or OSHA, as they're commonly known. And that would implement, so that was proposed in the fall of last year. And that would implement a consistent national standard across all of the United States. I know with the current changes in the administration in down there, the future of this regulation is a bit uncertain right now. I know that there's been some indicators that they are planning to scale back on some proposals that were already in the works from the previous president, and so they're in the process of reviewing all of the current regulations or proposals that are out there to see if they are planning to continue with that. But I think the note there is that I think at least all of our clients in the U.S., this would be a very big deal to have a new standard that applies nationally. So there's a lot of attention on it for workplaces in the U.S. But even if it doesn't happen, or even if it gets delayed, the message here is that the individual states are continuing to propose and adopt standards regardless, and kind of going it on their own because of the recognized hazards that they've found.
All right.
Okay, and yeah, so this next one, we also thought this was worth mentioning. I think when you think of fentanyl, it's not the first workplace safety issue that comes to mind, most likely, especially from a workplace exposure standpoint. You usually think of it more in the public health or crime or in international trade policies most recently. But we did want to note this here, that BC has adopted a workplace exposure limit for fentanyl. I know that, so this is the Manufacturing Safety Alliance. So I know that this is perhaps a bit more targeted for healthcare settings or for labs and whatnot that would have a greater risk of exposure here. So just calling it out though, just for general awareness, the workplace exposure limit was added to the list of regulated substances within section 5.48 of the regulation. They imposed an 8-hour time weighted average of 0.1 micrograms. It is an airborne limit as well, so that's worth noting. So this is talking about respirable exposure to fentanyl. And then with the 8-hour time weighted average, the way that the regulations work, then based on that, there are you could extrapolate from that a 30-minute total workplace exposure period of no greater than 0.3 micrograms, or a single exposure limit of 0.5 at any time. So and then, again, I know this may have limited applicability for much of the audience, but if this substance is, or maybe as a general review, where regulated substances are present in the workplace and cannot be eliminated or substituted as the first priority, then the employer will be required to implement an exposure control plan to maintain levels below those limits.
All right. All right, so we'll go through the last couple a little quicker to leave room for Q&A. So I have here in BC's for washroom facilities, we just had on October 1st of last year, new requirements where if you're a construction project with 25 or more workers present at any one time, that you have to have properly working flush toilets. And if that's not practical, then you can do the chemical toilet, as well as you have to have hand washing facilities for cleaning and that you're going to need to clean and sanitize on a frequent basis, and that you would maintain records for at least 30 days. There's some additional requirements that the toilet facilities need to be illuminated, ventilated, and if practical, heated. And again, I think a lot of us on the call today, this is not our primary service or operation of having a construction project. But I think it's worth taking a look at part 20 for what the definition of a construction project is, just in case one of your sites does have construction going on and you want to just make sure you're in compliance with this new law. If you have hired a prime contractor, it's actually their responsibility. So you can kind of go, phew, they're in charge. But you might want to just double check because maybe they haven't been really implementing the changes. There was also a recent change or amendment released on January 23rd of this year related to the OHS guideline related to washroom facilities. But I also think it's important to note that WorkSafe BC's board of directors have also identified they want to further assess section 4.85 of the regulation to propose going beyond just construction and to those industries where washroom facilities aren't really generally available. So if you're in the agriculture, forestry, highway maintenance, trucking, or transit industries, stay tuned as we are anticipating some proposed requirements to change around section 4.85. And then in Ontario, they also did similar changes. They aren't as specific as BC in that really they're just focusing on making sure that they are clean and sanitized. Where they're slightly different is this is going to apply to both construction projects as well as all employers. So I would have hoped that if you're a manufacturing, your washrooms were kept clean anyways, but Ontario has decided to like, hey, full gamut. If you're an employer, any washroom you have and any construction site you have, you must keep clean and sanitized. Actually, a new regulation is going to come out starting January. It's published, but it'll come into effect on January 1st of next year, where you have to actually maintain cleaning records. And you have to post them. So you can either do it digitally or physically as long as the workers can access them. And then the construction project regulation is actually going to be amended or come into effect on January 1st as well. Just really stating that those records need to be kept available for 6 months or for the duration of the project, whichever is shorter. So if you have a legal register starting next year, you're going to have a new regulation that you're going to want to add to that. The last one I want to hit on was really based on research that was conducted by the Canadian Standards Association in 2002 related to the Canadian women experience wearing personal protective equipment in the workplace. And essentially, this report said that within the regulations of Canada, that Manitoba was the only province in Canada that actually required the employer to ensure that the PPE both fit the worker and that when used did not cause an adverse effect to their worker safety. Now, since then, Ontario did an amendment to their Occupational Health and Safety Acts, which just came into effect on December 19th of last year, to amend their section 25, subsection 1B, that will mandate that your PPE and clothing must be properly fitted, considering that and has to consider all relevant factors. So essentially body types. So it's not just gender, it can be any body type, and making sure that your PPE is going to be fitted properly. So on that trend, WorkSafe BC's regulatory work plan actually identifies that they want to look at their regulation and identify and address the issues of fit. They've spelled out specifically with a gender inclusive lens. They do recognize that there is the OHS guideline already that's ensuring adequate fit, but it's a guideline, not a regulation. So anticipate some proposals to come out in the near future. There's just not any yet. And the final kind of throw the net out there, the Canadian Federal Labor Program, they also have a work plan of what regulatory items they're going to look at. And they've also flagged in the next 2 years that they're going to look at their 5 occupational health and safety regulations to update references not only to proper PPE technical standards, but also ensuring that the PPE fits employees properly despite their body types and individual needs. They did mention they proposed these regulations to come out in the spring of 2025. So again, just stay alert. There is a link here attached where you can go read that research project I found it pretty cool. So that comes the end of all the regulation updates we had for you today. I hope you can bring a lot back with you and found some areas that maybe you want to start implementing at your site. We just want to mention that STP Compliance is going to be at the Make It Safe events, both in Okanagan on April 10th, as well as in Vancouver in October 8th and 9th. So you may or may not see us, but you're going to see members of our team there. Feel free to ask them any questions and explore us further. So with that, I'm going to pass it back.
Thank you very much, both Shannon and Frank. Lots of information. We only have a few minutes, but I think it was great that you guys shared a ton of information. Unfortunately, I'm having some additional technical difficulties here with my camera, but that's fine. So let's go through and see if there's some questions. Again, a recording of the session plus a PDF presentation will be shared with everyone later so that you can rewatch, catch all the details that they provided, because that's a lot of information. And we want to make sure that you guys can kind of filter through, take what's really usable for you. Maybe just a couple quick questions, if I could rapid fire here. I'm going to go actually right down to some of the questions that came in from those part of the webinar today. Lots of employers have an EAP, FSEAP to support with mental health. What else can employers do in terms of psychological safety to improve and align with regs, and how should mental health issues be reported? As an example, on the first aid form. Really
Wow, that was detailed. Frank, you want to take that one?
Oh,
Yeah.
well, I mean, yeah, there's a lot there. I mean, we did post some guidance documents from WorkSafe BC. So I guess, that's always where I would point if you're just looking to get started or looking for some more tips. Looking to the agency and what they put out as far as recommendations. So we did put a couple links to some recent updates in the slide deck for that. And then, I mean, answering more generally, I think it really comes down to the risk assessment process as well. And so, a lot of it it's going to depend. I know that sounds like we're deflecting the answer, but a lot of it does really depend on the circumstances of whatever kind of business you're in, where you're working, and the scenarios involved. So it really comes down to that assessment of what is present and what hazards and risks your workers are facing. And that's really going to lead to the most effective way to respond.
Yeah. Yeah, no, I appreciate that. I think it's an ever-changing kind of conversation with employers and giving them education. I know WorkSafe is coming out with a lot of their programs around the psych health and safety. I know for ourselves, Manufacturing Safety Alliance, Dr. Conway is working on other programs as well to support employers and workers. So another question I have here is around the harassment, bullying, and violence in the workplace. I wanted to touch on one question because, of course, there is a difference between violence in the workplace internally versus violence in the workplace externally. And I wanted to maybe get you to comment on that, because it's people coming from the public side of things into a workplace causing violence, or somebody internally, obviously, creating a violent act within the workplace. There's some guidance you want to provide on that?
That's a good point. So the changes that are proposed, it does address both. So it considers both internal and external. So sort of, I guess, direct, employee one-on-one, or one employee to another employee, and then also, very prevalent in service industries or healthcare industries, that external side as well. So both factors are considered in the updates and also in the guidance documents that the agency has put out.
I'll just add one little thing that I've run into personally is from an external perspective. Yeah, when you're doing your assessment, you'd be like, well, am I close to any areas that the violence or the harassment might be escalated? But it's really important to also kind of have a tap on your employees. As you might have heard, like there's some situations where like a spouse had some issues with the employee and had access into the facility and decided to create some violent harm there. So it's not, there's definitely this privacy versus balance of like, are you going to have your tap on that? But just make sure that you're constantly reviewing that violence and harassment program for situations such as that. And let your let your employees feel comfortable to come to you to say, listen, I feel unsafe, to make sure that you could give them that extra protection in the workplace.
Great. One of the questions that, and maybe building on that, what is the new regulation regarding an employer's obligation in cases of domestic violence? So it kind of dovetails on that. Is there any guidance you have on that?
I have to, I'm trying to remember. I did read through it in detail. I would have to look further as far as if that's addressed specifically. I mean, again, it goes back to that it does factor in internal and external, but I can't recall if there was any specific mention of that.
We can circle back on that maybe as an answer we can
Yeah.
give to our questioner a little bit later.
Okay.
Specific to washrooms, can you maybe just quickly here explain what a chemical toilet is? There's a question around that. And does the hand washing facility require or specify a minimum flow of water for a faucet? Again, getting into some of the details here, but maybe you can give some quick answers.
The chemical toilet, I guess they would say like could be your porta potty situation. So that's what I understand. Again, I didn't read the guideline though. So when it came to a water flow, it's very possible that for your hand washing that it's in the guideline. It is not in the regulation itself though. So there's no constant stream. So that's a good question. So let's take that way, and I could definitely look up the guideline and give a proper response.
No problem. Again, great questions, and we can take them back and provide some answers to the audience that's here today a little bit later. I have one here specific around regulations. We have one member today that's located in the United States, and their coverage area was just expanded to include Canada. Could you provide central location to find environmental regulations, something similar to the codes of federal regulations or EAP for Q&A found on websites? Is there some guidance you can give there?
Shannon, do you want?
I mean, I don't want to don't want to promote us, but that's exactly what we offer. So we have across Canada, so you could access, you could call us up. We could show you what our Canadian coverage is. We have a library of all the full text requirements for EHS across Canada. And we do all the monitoring, and we have the audit content as well. So that's a one-stop shop for you.
Right. Yeah, we hear that a lot where someone's given new responsibility, or they're expanding to a new region, a new country that they're not familiar with. So that's often a conversation starter of why a company reaches out to us in the first place.
Well, exactly. I mean, that's why we've certainly partnered with you guys, because we do have a number of companies that are multi-jurisdictional. They expand across Canada, operations throughout North America, and maybe even beyond. And so this helps them just really kind of understand. I know for myself, it was always a challenge kind of knowing the nuances between the interprovincial and then, of course, OSHA and beyond. So knowing that you guys existed would have been helpful a number of years ago. Thank you very much. But it's a great segue to thanking you both for being here today. It's a lot of information, and I think our participants will take a lot away in getting those slides. And if there is any other questions that we have, we'll get those to you and then get them back out. So again, thank you, Shannon, Frank, for joining us today. To everyone in our audience, thank you for your questions. Any questions, as I said, not answered, we'll ask Shannon and Frank to answer them later, and we'll be back to those with answers on our website and beyond that. Our next webinar, just wanted to mention, is coming up March 6th, 11 a.m. And this is the 1, 2, 3 of OC. Obviously, for small businesses, an introduction to the Occupational Safety Standard of Excellence, or CORE as we know it, the certification for small businesses. We'll walk through those steps and explain how the pathway to certification can help you reduce your risk and leverage other financial benefits. And it's free for all small businesses to join us. So please do check us out. Coming up, of course, we've got our Make It Safe Vancouver Island coming March 13th. Save your seats for the best practice and hands-on workshops that we've got coming to the Vancouver Island. We're really excited. This is our second year coming back to Vancouver, and we look forward to seeing you there. On March 15th, stick around for our 5S training. This is something I've really want to expand upon. I mean, again, if you learn the principles of 5S, we can really make a difference in slips, trips, falls at the same level. So again, training and certification for that will happen at our Nanaimo venue on March 14th. Additionally, we are also, for those in the Okanagan, we got our Make It Safe Okanagan April 10th. Lots of details. Check us out at makeitsafe.ca. And there are still some seats available for our 2-day dust hazard analysis certificate training. It's been popular every single time we bring it. We're bringing it to Kelowna and to Vancouver, and we're going to have some changes because we're expanding it to cover all types of dust that employers may face in the workplace. So if you create or handle dust in your production processes, a great chance to get ahead of the new regulation expected later this year and into next year. Again, thank you for attending today. It's always, we try to give as much information as possible. Do check us out online. Look for access to our upcoming webinars, resources, and follow us again for today's recording. Get that to you. As you leave, please share your feedback and topic ideas through our quick survey link. We really appreciate you spending time with us this morning, and wish you all a great Pink Shirt Day. Thank you very much. Have a great day.